For over 5 years now, I've been on a mission to raise awareness about what I consider to be the greatest child abuse scandal in the history of modern medicine, the practice of what is known as gender-affirming care, or colloquially known as trying to change the sex of children with puberty-blocking drugs, the opposite sex's hormones, and surgeries. All because of this idea that these children are what is known as transgender. Now, this might be shocking to some, but I maintain that there's no such thing as a transgender child. I have had thousands of conversations on the street. I go to university campuses all around the world. I go to conferences. I work with psychologists, psychiatrists, doctors, all the major conservative organizations across the West as well. And in all of my time having these tens of thousands of conversations, I haven't yet met one person who can tell me what a transgender child is. What does it mean to be transgender? What does it mean to have a gender identity? I am going to go through a few slides today to discuss what I consider to be really one of the greatest lies ever told in the history of the human race. The positive message we should be sending our kids is that they're beautiful just as they are. Instead, they're getting a message that they were born wrong and they need to change their body. The only thing that is affirming in children is self-hatred. And we'll get into what type of children these are who are identifying this way, and in particular, we'll get into what type of children are going to gender clinics and what's being done to them. But let's go to the first slide if we can. Thank you. So this is difficult to read from your distance, but this is honestly the most used resource in the world when defining what these various terms surrounding gender ideology are. So this is called the Genderbread Person. This is produced by an activist. And it defines on the left side there, under gender identity, it says that we're all on a scale of womanness or manness, and that our gender identity is based on our personality, our job, our hobbies, our likes and dislikes. And I would maintain that this is a rather regressive and sexist way to look at what your gender is. What does your job have to do with your gender? What do your hobbies have to do with your gender? Are we going to tell little boys who like to bake with their mom in the kitchen that that must put them on the female spectrum of gender? That's absurd. Are we going to tell girls who don't want to wear dresses and who want to have short hair, perhaps who like to play sports with the boys, that that makes them a boy? This is nonsensical. More than half of the women growing up are what we would call in North America tomboys. It's just more fun, perhaps. You don't have to wear a dress to be a girl. The positive message, again, we should be sending kids is there's no right or wrong way to be a boy or a girl. If a boy is more effeminate, he's not trans. He's just a boy. But this ideology has come along and it's taught our children that if they don't conform to what are these stereotypes, that they might be transgender, that they might have been born in the wrong body, and that the solution for them is to go on drugs that have never been approved for this purpose. We are giving children chemical castration drugs that are used to this day on sex offenders. They're given to pedophiles. In certain states, and even in Canada, they have been required for pedophiles to be eligible for parole, that they received these chemical castration drugs. The same drug is now called a puberty blocker. What are these drugs? These are gonadotropin-releasing hormone analogs. They stop the pituitary gland from releasing a couple hormones called luteinizing hormone and follicle-stimulating hormone. And these are what are responsible for the generation of your sex hormones at the onset of puberty. Girls develop estrogen. Boys produce testosterone. And this is what causes us to generate what are known as our secondary sex characteristics. All the things that happen during puberty. Boys get stronger, they get a deeper voice, they get a hairy face, hairy body. Girls develop their breasts, their hips get wider. While children are on these drugs, none of these secondary sex characteristics will develop. The idea being that we need to keep these children looking neutral, because if we don't, they will develop into a man or a woman, and that will make it harder for them to pass as the opposite sex when they're an adult. So I don't want you to take my word for anything here. We're going to go over a few of the videos that these doctors at these gender clinics have produced. So first, let's hear from, this is Dr. Jeremy Carswell. She is at the gender clinic at Boston Children's Hospital. She's the director of their gender multi-specialty clinic. This was the first gender clinic that opened in the United States of America back in 2007. And she's going to talk about really what it is to be transgender.
A child will often know that they are transgender from the moment that they have any ability to express themselves, and parents will often tell us this. We have parents who tell us that their kids, they knew from the minute they were born practically, and actions like refusing to get a haircut or standing to urinate, trying to stand to urinate, refusing to stand to urinate, trying on siblings' clothing, playing with the quote opposite gender toys, things like that. There is more and more a group of adolescents that we are seeing that really are coming to the realization that they might be trans or gender diverse a little bit later on in their life. So what we're seeing from them is that they always sort of knew something was maybe off and didn't have the understanding to know that they might be trans or have a different gender identity than the one they had been assigned. So that is a growing population that we are seeing, and that's being recognized as being trans and able to be treated.
So if you have a child playing with the opposite gender toys, they might be trans and eligible to be treated. If a little girl tries to pee standing up or a boy tries to pee sitting down, they might be transgender. Guess what? If a little girl has 3 big brothers, she's going to try to pee standing up because they're all peeing standing up and it looks kind of fun. They're kids. She said if they're trying on a sibling's clothing, they might be transgender. Again, a little boy with 3 big sisters, they're all going to be playing dress up with their little baby brother. But these doctors come along who have bought into this ideology, and they teach that this natural play is a sign that your child is transgender and can be treated. And guess what? They're seeing patients as young as 3 years old, where they start socially transitioning them with a new name and pronouns. I don't want you to take just her word for it either. Here's another doctor at the same hospital.
So most of the patients that we have in the GEMS clinic actually know their gender, usually around the age of puberty, but a good portion of children do know as early as seemingly from the womb, and they will usually...
That's enough from her. Seemingly from the womb. I recorded these videos a few years ago, back in 2022, and this next one is the one that I had first tweeted out, and it started to go viral. And what happened was Boston Children's Hospital took all of their videos down off of their YouTube channel, but not before I had recorded about 40 of them. And this next one is a sign of the insanity that is going on in these gender clinics. And I know that these are from America, but please keep in mind that all of these gender clinics follow the same standards of care, written by a falsely scientific body. It's just an activist body, but it's called the World Professional Association for Transgender Health. And they're currently on their 8th recommendation of what are known as the standards of care. And this is what they're doing with these young people.
Gender-affirming hysterectomy is very similar to most hysterectomies that occur. A hysterectomy itself is the removal of the uterus, the cervix, which is the opening of the uterus, and the fallopian tubes, which are attached to the sides of the uterus. Some gender-affirming hysterectomies will also include the removal of the ovaries, but that's technically a separate procedure called a bilateral oophorectomy. And not every gender-affirming hysterectomy includes that, and people who are getting gender-affirming hysterectomies do not have to have their ovaries removed.
If you put perky music and a smiling woman, I guess you can even try to justify gender-affirming hysterectomies at a children's hospital. what is being done is they are sending teenage girls into menopause, which has 100 side effects of its own. And they call this love. And we're supposed to be quiet about it, because they've conflated gender identity with being gay. They put these letters together, 2S even for two-spirit, but 2S LGBTQIA+, all of these different letters representing different cohorts. And they pretend it's one big community, and they use this to silence people who dare to object to any of this. But this is child abuse. Again, based on this notion that there's a right way to be as a boy or a girl. Now, in history, this used to be called something called gender identity disorder. That term was coined in 1964 by a man named Robert Stoller, who was a professor of psychiatry at UCLA. He viewed this as a disorder. And this was almost all little boys that this used to affect. And they wanted these little boys to grow up and be more masculine. These were boys who were effeminate, who they should have just left alone. But instead they were deemed to have a disorder. And the man who coined the term gender identity, his advice was that these little boys shouldn't spend as much quality time with their mothers. You can look it up, because that might feminize them more. They should have more time with their fathers. Going back even earlier than this, this goes to the Weimar Republic, to pre-World War II era in Berlin, when a doctor, Magnus Hirschfeld is his name, he had ended up opening up this Institute for Sexual Science, and he was friends with another man named Harry Benjamin, and they performed the first ever surgeries trying to turn men into women, which of course is impossible. But they actually transplanted a uterus into a man at this clinic in Berlin. The doctor who performed that surgery, his name is Erwin Gorbant. He later was a member of the Luftwaffe, and he helped design freezing water experiments on Jews at the Dachau concentration camp. But Harry Benjamin was friends with this original researcher. And Harry Benjamin went on to form the Harry Benjamin Foundation, which today, it was renamed in the 90s. It's now what's known as the World Professional Association for Transgender Health. And this is just an activist body pushing ideology. Because the truth of the matter is we don't have gender identities. We have personalities. And you don't have to be like everyone else in your class. You don't have to be like the other boys. If you're a boy who's not rough and tumble, who doesn't want to play sports, and maybe you're more sensitive, that's okay. You're still a boy. But this message we are sending to our children is that they have a brain detached from their biological reality, from their genitalia, which is completely and utterly false. It's been debunked. There's no evidence to support this whatsoever. But this ideology was dreamed up by a few individuals. And then in the 70s, Professor Paul McHugh at Johns Hopkins University, which was one of the leading universities pushing this through a doctor called John Money. Now, Dr. John Money was looking into disorders of sexual development. These are what activists today would call intersex disorders. But nobody is intersex. Nobody is between sexes. Nobody is a third sex. There are people who are born with some disorders. These are a variety of medical conditions. The term intersex is an umbrella term for a variety of disorders of sexual development, all of whom affect males or females. Now, trans activists will try to use this to get you caught up in this discussion, as though they're not all male or female. It's really a diversionary tactic, which we should largely ignore. It makes sense to understand a little bit about this. But on the subject of gender identity, it's got nothing to do with that. Gender identity is teaching that people have a gender, a circular definition, that they have a gender that might be different than their sex. Well, what is gender? We should always be able to define these terms. And what is gender? Leftist university professors have redefined this term. For the longest time, we all used it as a synonym for sex, perhaps a more polite word. But today it means something else entirely. It just means a feeling. Your gender, according to feminist scholars in universities, is whatever you feel it to be. But this, of course, is not true. There is such a thing as reality in the world. And when we become unhinged from reality, all sorts of bad things happen. And where we had this small cohort of mostly men wanting to identify as women, what's happened in the last 15 years in particular is perhaps to buy legitimacy for their own issues, this has been pushed on to kids. And what used to affect maybe 1 out of 30,000 boys 30, 40 years ago, if you look at the statistics, gender identity disorder affected just a tiny handful of the population. This has now exploded. It's a social contagion spread primarily via social media, but from peer to peer and through schools. And it's a social contagion primarily affecting girls, as all social contagions do. It's always the girls that these social contagions really come for. And so when we look at these kids at these gender clinics, we find that on average, and this is according to the Tavistock's own data, the Tavistock was the gender clinic in the UK, seeing all of the children. And Dr. Hilary Cass, an eminent pediatrician, conducted a review, a systematic review, the gold standard in medicine. It's a 388-page report. I encourage everyone to at least read the summary. But that report, after several years, found that there was no evidence of psychological improvement for any of these kids receiving these drugs and hormones and surgeries. The evidence is scant, it's non-existent, or it's extremely low quality. There was a systematic review done in Sweden. It found the same results. The most thorough review done to date was done this year by the HHS, Department of Health and Human Services in the United States. And it's peer-reviewed. Even the Washington Post said that it was a very balanced report. There's no arguing with these reports. They've gone over all of the peer-reviewed journals, all of the studies, and they've all come to the same conclusion, that there's no evidence this is helping kids. So if it's not helping kids, what are we doing sterilizing kids? These children, according to the Tavistock in the UK, 70% of these kids had 5 or more coexisting mental health comorbidities. They didn't just have 1 or 2 other problems, they had 5 or more. They have autism in likely a majority of cases. I want to say a strong majority for the more mild cases. But we know from the Tavistock that 35% of their patients, out of a sample of 1,069 kids, 35% had moderate to severe autism. These are kids who have suffered sexual abuse in a majority of cases. The president of the American College of Pediatricians tells me personally that he estimates it's about 60% of the kids have had sexual abuse. Anecdotally, if you read the stories of these people, I would say it's even higher, especially if you listen to the stories of detransitioners. These are kids with eating disorders, borderline personality disorder. Oftentimes, according to one older study, 52% of the mothers of these boys had borderline personality disorder themselves, compared to just 6% of the general population. Isn't that interesting? If this is something that's innate, why is it that more than half of the mothers had borderline personality disorder? Because it's not innate. This didn't exist when I was a child. There weren't children going around thinking they were born in the wrong body. Tomboys were just tomboys. That was great. They should be celebrated. You should be celebrated for who you are, not told you're supposed to be something you're not. Now, this next video is a young woman I ran into at UCLA, the University of California in Los Angeles. Her name's Clementine. This is a 6-minute long video, and she's going to tell us her story. I randomly ran into her here. Yeah, come on in. What's your name?
My name's Clementine.
Nice to meet you.
I've actually seen your stuff online, and I'm
Yeah.
a huge fan. I was on puberty blockers. I started when I was 12, and I was on testosterone from 14 to 17, and I got top surgery at 17. Totally messed my life up. So I just want to say you're doing a good thing.
Wow.
I can't believe people disagree with you on this. As a former child transitioner, I'm just appalled that people have anything to question you about. So I salute
Well,
you.
I'm so sorry you had to go through all that. I'm glad you are through it now. Thank you so much for speaking up. That's extremely valuable because a lot of people are afraid to.
Yeah.
So, do you mind if we have a little conversation about
course,
it?
yeah.
Okay, come on in this way just a little bit.
Oh yeah, for sure. Hi.
So, your name again?
My name's Clementine.
Clementine. So, Clementine went on puberty blockers at what age?
12.
And you detransitioned at?
I detransitioned earlier this year, actually, but I had been going off testosterone since about 17 because
Okay.
it gave me psychosis.
When did they put you on testosterone?
I was 13.
Wow. And when did you have a double mastectomy?
I had a double mastectomy at 14. I'm currently going through the process of getting reconstructive surgery, and it was harder to get that approved. I actually wasn't able to get it approved by my insurance.
Right.
But it was much harder to get surgery for that than it was to actually get the original top surgery procedure.
For everyone watching this who says this isn't happening, well, it
Yeah.
happened to Clementine. At 14, a double mastectomy, puberty blockers at 12, testosterone at 13. How old are you now?
I'm 20 now. I just turned 20.
Have you ever talked to anyone about suing?
I can't disclose
Okay.
what's going on, but yeah, it's
Okay, because I'm
That's
here to help
definitely
you
something I'd
find
like
someone
to
if you
do.
need someone.
yeah. I've spoken. Do you know Campbell Miller Payne?
I do.
I've talked to them a bunch.
Fantastic. So, Campbell Miller Payne is a law firm for dads in Texas who all left their previous law firms and started a new one just to sue for kids and young people like Clementine who've been harmed by this madness. And these are great guys. They could have done anything to make a bunch of money, but they started a law firm. They left all their previous firms. They have 18 kids between them, and they're going to cause a lot of waves. I know some good lawsuits coming too, which we aren't allowed to announce yet.
Yeah, I really
But
hope so.
that's one of the way
I don't
out of this
know-
mess we've gotten into.
I don't know how a child could consent to the loss of their fertility.
Yeah.
Children can't conceptualize that, and I think people don't understand that.
So, what got you into this in the first place?
I was sexually abused as a child, and that was totally ignored. But I started having a lot of negative feelings about my body around puberty, and I was egged on by some guidance counselors that I might be transgender, and I later decided that I was really a boy, and my life would be so much easier because of all this abuse that I had experienced because of being a woman, and I totally just rejected womanhood because I thought that all that it meant for me was pain. Yeah. That's kind of how I got there, but
And what got
getting
you out?
out of it, getting out of it was a really difficult process for me, but mostly it was just getting the right therapy. I went to DBT therapy, and we never discussed my gender. We only discussed my sexual abuse, and after I dealt with that, I realized I didn't want to do this anymore, and the loss of my fertility and my body just started to really sink in, and I realized, oh my God, I've built this entire persona around misogyny.
Do you know for sure that you've lost your fertility?
I'm not 100% sure,
Okay.
but
you were on
I'm not the
testosterone
most
for
helpful.
4
I never
years.
went through female puberty, so yeah.
Right. I'm so sorry, but thank you so much for speaking up.
Yeah,
It's
thank
extremely
you for
brave.
speaking to me.
It's extremely powerful. I'm so sorry what was done to you, but this is going to help other people not.
I'm so glad you're
fall
doing
down
what
this
you're
rabbit
doing.
hole.
Keep going.
One last question, and just come in a little bit.
Yeah, of course.
Before you started on the puberty blockers, you've just shared with me this sexual abuse that happened to you before you started on those.
Yeah.
Did anyone ask you about that?
No, not was that brought up once during the meeting. I was only asked, do I like hanging out with boys? Do I get fit in better with boys? What kind of things am I into? Just really surface level questions. And I was prescribed puberty blockers 30 minutes into my appointment after being out for 4 months.
First appointment
Yes.
with.
Dr. Joanna Olson Kennedy at Los Angeles Children's Hospital.
Johanna Olson Kennedy. I've talked a lot about her, and I'm going to put more about her underneath this video. She's running the busiest gender clinic in the country at Children's Hospital of Los Angeles. She received a grant from the NIH a few years ago for $5.7 million And part of that grant application, she asked for approval to give opposite sex hormones to kids as young as 8 years old.
Yeah,
She is one of the biggest, if not the biggest, gender ghoul in the United States of America. Did she talk to your parents?
She did, and she told them the same thing that she tells everybody, that I was deeply suicidal, and that if they didn't let me transition, I would be at high risk for suicide. And I only attempted to kill myself after I transitioned.
So she convinced them that they had two options, a dead daughter or a live son.
Yes,
Did she even use those words?
she did use those exact words.
Wow. Give me a hug.
Thank you for talking to me.
Thank you for talking to me.
Have a great rest of your day.
All right.
God bless you.
I'll see you later. It's a standard story. Listen to any of the detransitioners' testimonies. They're all like that. And it's not just America. It's where I'm from, Canada. It's Europe. It's Australia. It's all of these Western nations pushing this because they all follow the WPATH standards of care. And in this most recent edition of the WPATH standards of care, being a eunuch is a gender identity. Being a eunuch. If you're a young man and you feel like on the inside you're a eunuch, they will do surgery to make you one. If you feel you are non-binary, meaning neither sex, and you want what is called a nullification procedure, male or female, they will cut off your sexual organs, they'll do a hysterectomy to give you like a Barbie look. This is not science. This is mad science. This is Frankenstein science. She's sterilized. She can never have kids, and she's just 20 years old, just turned 20. Her life hasn't even barely begun. And the most valuable thing was taken from her, her chance to have a family of her own. And this has been done to thousands of kids, and it's being done to thousands of kids today. And it's being done largely in an environment of silence, because people are too afraid to talk about it. Why? They're sterilizing autistic children and a lot of girls and boys who've been sexually abused. We shouldn't be quiet about it. We should all be yelling from the rafters. I quit my job, not the most normal thing to do. I quit my job to stand on the street wearing a sign because I didn't know what else to do. I had actually put up a billboard in my city of Vancouver that said, "I love J.K. Rowling," because she's spoken out about this, and she's spoken up for women, of course. And they took it down after a day because a Vancouver politician said it was hate speech. It had a big red heart on it. So then I did a whole bunch more in the United States, and then in Canada, where I was stuck, it was during COVID, we couldn't even leave the country. I said, well, you can take down my billboard, but you can't take one off my back. And I had some signs made, and I know I look silly, but for some reason I get respect, and I traveled across the country and then across America and now the world. And I just keep going, one conversation at a time, because I have faith in my fellow man. I have faith in you, that you're going to learn things here today and take this forward with you and start more conversations. And let's look what's been done in Europe. So in England, thanks to the CAS review, they stopped giving kids puberty blockers. They didn't stop doing the cross-sex hormones, although it's been reduced. Scotland went even further and they stopped the cross-sex hormones. Although now they're going kind of backwards in England, in the UK, and they want to do a clinical trial. They have 20 years worth of data, but they want to do a new 2-year trial. It won't have any long-term information. So people are in the process of suing to try to stop this because it's madness. But in Finland, they were the first to break ranks with this. They stopped it there. Sweden stopped it, basically. It's still done in a few exceptional cases. Norway and Denmark pretty much followed suit. New Zealand, just this last month, announced that they are following the CAS review, so they've stopped it. 28 states in the United States have stopped it. You've got 50 different states there, each with their own health departments, so you have to stop it in each jurisdiction. But in even some of the Democrat states, the gender clinics are shutting down. The woman, Johanna Olsen Kennedy, who transitioned young Clementine there, her gender clinic at the Children's Hospital of Los Angeles was shut down because the Trump administration was pulling funding. But here on the continent of Europe, there hasn't been a ton of progress. And the leaders of society are still too hesitant to talk about this, and I get it. Until you understand how to speak about this, it can be an awkward thing to speak about. And when you know that activists are going to come and they're going to try to demonize you, I suppose that can be a bit scary for most people. I just lean into it. They can say whatever they want about me. It doesn't matter. I know who I am. My family knows who I am. And I think everyone who's ever heard me speak has an idea that this is all evidence-based and we're trying to protect kids here. But again, this all goes back to the initial lie. And it is a lie. It's a lie that we have a gender identity. We don't. There's no such thing as a transgender child. They're called boys and girls. And they're perfect just as they are. If they want to do something to their body as an adult, that's a different conversation. The doctors should still be following the Hippocratic Oath, which is first do no harm. They should be screening for trauma. They should be screening for abuse. They should be treating mental health problems with mental health solutions, not just taking money and getting out the scalpel. Now, this next video, that is on the right side of the screen. That is a male named Marcy Bowers. That's a man. The woman in the center is Dr. Johanna Olsen-Kennedy. This was a leaked video. This was an internal video conference they were having, and they're discussing the ability of boys who started puberty blockers at Tanner stage 2. Tanner stage 2 is the beginning of puberty. This is when you first develop pubic hair. It's when girls' breast buds first start to form. So these kids are all 10, 11, 12 years old, and that's when they start them on these drugs. Again, these drugs have never been approved for this purpose. These are prostate cancer drugs. These are drugs for endometriosis, for uterine fibroids, but they happen to stop puberty. So they're discussing how it's destroying the future sexual function of all these boys. They admit to this, and I want you to hear it from them.
The second is was an observation that I had that every single child who was, or adolescent who was truly blocked at Tanner stage 2 has never experienced orgasm. I mean, it's really about zero. These are of course, these are just assigned male at birth, so trans feminine, and it's because they never in their lives are exposed to testosterone. That doesn't change. That doesn't change. So blockers prevent the rise of testosterone, and they don't really go on testosterone at or around surgery or into adulthood. And so we don't know. They're going to have this sensation. There's no question about that. But are they going to be able to achieve sexual satisfaction? It's important in relationships. And I know that from my work with female genital mutilation survivors, that the lack of being able to be intimate with a partner is very important. And so this is what really raised the red flag for me, is to say, look, we need to have our eyes open about it. I think it's been beneficial talking about it. I know Joe and many others have reported to me, you know, they've changed their approach a little bit in their informed consent models, and that we're talking about masturbation now. We're talking about, okay, that's an area of the body that's got very dysphoric for you, but you know what? It's all a penis is just a large clitoris. I mean, it's all the same material. It really is. So you know, use it for the pleasurable purposes, partially that it was intended, and you know, we'll see what happens. But these are to be answered questions. So can we avoid puberty and get good adult results? And secondly, how do we assure someone that they're going to be able to be sexually responsive? Do we remove the blockers during the course of their adolescence and let a little bit of puberty come back? Do we delay it a little bit, maybe into Tanner's 3 or 4, maybe before they have their first orgasms, maybe?
I apologize for the graphic nature of this. It's important to understand. That's the president of WPATH. That all the countries that you represent, they write the standards of care. All the countries, gender clinics, all follow their standards of care. The UN pushes their standards of care. The WHO pushes their standards of care. That's the president. And what's he saying there? He's saying, what do we do? Do we let a little bit of puberty happen? Do we take them off the blockers, let a little puberty happen? Do we delay the puberty blockers? They don't know what they're doing. They don't know. He admits it. This is an experiment on children, the most vulnerable children among our society, the kids who've had terrible upbringings. I ran into a young man on the streets of Vancouver last week. I have this video up. You can go to my YouTube channel. He was sexually abused when he was 5. He was raised by Wiccans, occultists, Satanists. His memory's foggy. He has a memory of his mom taking him into some other room and crying after this sexual abuse at 5. He remembers satanic symbols, pentagrams. He ended up being taken into state care when he was 8 years old. He was in 14 different foster homes, 3 group homes during his adolescence. And in one of these foster homes, he started growing his hair long. And some people said that he looked pretty. And maybe that meant he was really a girl. And so for over 20 years of his life, he identified as transgender. This was a deeply abused little boy. These are the types of cases of these young children who are being harmed. They're not all that extreme. But there's always, as I mentioned, 70% of the time, there's 5 or more coexisting mental health comorbidities. So is it the autism, is it the sexual abuse, or is it trans? Trans, a term that we can't even define. It means their gender identity doesn't match their sex assigned at birth. That's what the activists might tell you. Well, what's gender identity? The first slide I talked about today, what's gender identity? It is, well, it's your personality, it's your job, hobbies, likes, dislikes, roles in society, and expectations upon you. That's how they define it. Sexist, regressive, nonsense. So, what happened in, we don't have too much time. These are some more videos from these people. I'm not going to get into them all. These are internal documents that were leaked. These are known as the WPATH files. If you go to my website, wespeaktruth.com, go to resources, you'll find these documents, you'll find the CAS review, you'll find the HHS review. But this again is the president saying that the fertility question has no research that I'm aware of, as puberty onset allows for fertility options. If they allow puberty to begin, they can perhaps harvest sperm and eggs, which they can use later on to perhaps have success with fertilization. But he says puberty onset allows for fertility options while blockers preclude those opportunities. He's admitting that they're sterilizing kids. He repeats again here in writing, I'm unaware of an individual claiming ability to orgasm when they were blocked at 10 or stage 2. What 12-year-old boy can consent to throwing away his future adult sexual function? Of course, none of them. This is why the main sign I wear always says children cannot consent to puberty blockers. And those videos I just quickly went past, they admit to that in those videos. I'm happy to send you anything you need to know in the future. So this is another doctor admitting that, so this is a female they're talking about. She was on testosterone, T, for 8 to 10 years, and she developed hepatocarcinomas, liver cancer. To the best of my knowledge, it was linked to her hormonal treatment. I'm not going to use the wrong pronouns. I'm going to use pronouns that describe someone's sex, just so you know. She was in midlife. Unfortunately, I don't have many more details since it was so advanced that she opted for palliative care and died a couple months later. This is a 13-year-old that wants testosterone, and of course she's also has an eating disorder. This is very common, eating disorders. This is another doctor saying trauma is common among trans clients. I was surprised to find several of my clients met criteria for dissociative disorders. So this is what used to be called multiple personality disorder. These are people who've had severe trauma, oftentimes sexual abuse at a young age. And it goes on to say here, this doctor goes on to say, I was wondering if there's been any difficulty with the system agreeing to transitioning medically, especially given that not all the alters have the same gender identity. Not all the alternate personalities have the same gender identity. Insane. And they're transitioning these people. This one, someone can have schizophrenia and be ready for surgery. It's just a matter of what you see concerns are. So it doesn't matter what's wrong with these kids. They're transitioning them. The start of this in the modern era, it's known as the Dutch Protocol. And this started in the late 90s in Amsterdam. And it started at first with one girl who had severe distress about her sex. And so for the first time, she was given this prostate cancer drug, these puberty blocking drugs. And they ended up conducting a trial with 70 children in total in the first decade of this century. That trial has never been able to be replicated. There's all sorts of problems with its methodology. You can read about it later. But from the Dutch was born what's known as the Dutch Protocol. And their rules were they wouldn't give puberty blockers until 12 years of age, assuming the child had hit Tanner stage 2. And they wouldn't start the cross-sex hormones until 16. And they would screen for these other comorbid factors, other mental health issues. That's all gone out the window. There are no safeguards in place anymore. In fact, to even suggest that a child needs therapy is frowned upon because that's deemed to be questioning a child's gender identity. Why would you need therapy for your gender identity when your gender identity is just a natural part of your human existence? This is the thinking. And about 3 years ago at the WPATH conference held in Montreal, during the opening speech, some protesters got up and they were calling for the total abolition of all therapy. That sounds crazy. What response did they get? A standing ovation. Because over the years, what's happened is this isn't a mental health problem anymore. They even don't call it a disorder. In 2013, in the DSM-5, it went from gender identity disorder to gender dysphoria. Now they just call it gender incongruence. And if a little girl says she's a boy, if a boy says he's a girl, they say, wonderful. We're so glad you figured out your gender identity. And they start them on this treadmill of medicalization. Historically, this is going to be one of the last things I'll discuss. Historically, when you look at the academic studies into gender dysphoria before they started drugging these kids, and I have all of these major studies that were done, the numbers in these studies aren't huge because this was such a small problem. But the largest study had 139 participants. And they followed them from a young age, 4 or 5 years old, all the way into their 20s. 87.8%, this study was all boys, 87.8% of them grew out of it. Their gender dysphoria desisted when they went through puberty. And all the studies show similar numbers. Puberty is the cure for gender dysphoria, gender distress. Now we block the cure. Now we don't let these kids grow up. And a majority of those kids, according to all those studies, grew up to be gay. Makes a bit of sense when you think about it. We're talking really effeminate little boys with distress about being a boy. Yes, some of them grew up to be gay. And from the Tavistock in England, from all the most current studies, we see similar numbers that a majority of these children would grow up to be same-sex attracted. So what is it? I don't call kids gay or trans. I don't call any kid trans. I don't call kids gay. We shouldn't assign sexual orientation to children. Let's just let them be children. But are these individuals, are they gay or are they trans? This is a homophobic movement. This is taking individuals who would grow up to be gay, and it's telling them there's something wrong with them. They need to change their bodies. It's the most homophobic movement. In Iran, 10 years ago, on the women's national soccer team, there were 8 men. Because it's illegal to be gay in Iran. But because of the first Ayatollah, he issued a fatwa. There's a story behind this. You can go read it. It's okay to be trans. So the gay men in Iran, if they want to stay alive or stay out of prison, they transition. And Iran is the number 2 country in the world for sex reassignment surgeries, behind Thailand. It's the only Muslim nation that does that. But yes, this is a homophobic movement as well. So we have Finland. They were the first to break with the WPATH standards of care. Sweden followed. The UK followed with the CAS review. The HHS review in the United States is the most thorough review to date. It contains a section on the ethics of this whole thing. And so we're making progress. 28 states have stopped this. And I'm going to close with one 2-minute video of another young detransitioner woman, because, again, you need to hear it from them.
I can't believe this happened. I ruined my life. When you break it down, I decided that I didn't want to be a woman before I had ever even experienced being a woman. I had no idea what being a woman was like because I was a child. And now I feel like I will never entirely know. I want to say that I really feel like some people in the trans community and the trans medicalists and the doctors really, really target the most vulnerable of us. I have borderline personality disorder, and I know for a fact that this is the reason for my transition. It's a very difficult mental illness, and one of the core features is not having any sense of self or identity, and my doctors knew this. I told them, even though they didn't ask, that I had been diagnosed with BPD, and it was all fine to them. I wasn't happy as a girl, so that meant I was a boy, and I was trans, and so I just took the cure that was handed to me. I was told that I was being given a cure, and I wouldn't want to kill myself anymore. And it wasn't true. I didn't want to cry in this video, but this is such a hard thing to talk about. I lost a lot of things to this, and I just hope that anyone else who's going through what I went through as a young girl will not be prescribed hormones and surgery because of other things. You know, there are so many mental health disorders that make you hate your body, and the solution isn't to change your body, it's to fix your brain, you know? I just don't want anyone else to ever feel this way. I lost my voice, I lost my chest. I don't know if I'm gonna be able to have kids. I feel like no one wants to date me or love me because I'm ruined.
It's child abuse, pure and simple, and it's up to us to stop it. There's no one else that's going to stop it. It's up to us. So if we have to get a little bit uncomfortable to start these conversations, we need to start them because all the evidence is on our side. Really the only argument that the left ever has, and I say the left, it's really predominantly the left pushing this everywhere, but the activists, let's say, their only argument, they'll say that kids are going to kill themselves if you don't transition them. Because the only way you can justify this sort of abuse is to say that kids will die if you don't do it. But there's no evidence for that either. Both of these testimonies, they said they were suicidal after. The only study that's been done was out of Finland, where they looked at 24 years worth of data at their gender clinic from 1996 to 2019. 2,000 kids, more than 2,000 kids went through the gender clinic. They didn't all get medicalized. And they compared them to a sample group of 17,000 kids. Over the 24 years, there were 7 suicides. It worked out to an annualized rate of 0.052. And of course, every suicide is a tragedy. There were 17 suicides in the sample group. So the rate of suicide was slightly higher. But this is no epidemic of suicides. And the common denominator wasn't gender, it was other psychiatric comorbidities. And the only way they could really reliably determine who was at risk of suicide was more than 100 psychiatric visits. So we just can't let them use these arguments to try to silence us because there's no truth to any of it. The truth is that our children are precious and beautiful just as they are, and we're harming them. First of all, with this ideology, it's psychologically harming them, and the physical harm being done to them is inexcusable. So thank you so much for coming today. Appreciate it.